How should you really take amlodipine, also known as Norvasc? And what about the hidden side effects most patients never see coming? One of them is so subtle, many people never connect it to their medication. I'm Dr. Jenny Carter, and today we're breaking down everything you need to know about this widely prescribed blood pressure drug. Amlodipine is one of the most widely prescribed blood pressure medicines in the world, with millions of prescriptions written every single year. But behind these huge numbers lies a list of rules, precautions, and possible side effects that every patient deserves to know. Now, let's start with the basics. Amlodipine belongs to a group of drugs called calcium channel blockers. It works by relaxing your blood vessels and reducing strain on your heart, making it effective not only in controlling high blood pressure, but also in easing chest pain caused by angina. That's the benefit, but effectiveness isn't the full story. What happens to your body along the way may surprise you. So, who should not be taking this drug? If you've ever had an allergic reaction to amlodipine or other calcium channel blockers, this medicine is not for you. The same applies if you suffer from postural hypotension, where your blood pressure drops suddenly upon standing, or if you have unstable angina, a narrowing of the aortic valve, or significant liver or kidney disease. And here's a crucial point. Manufacturers do not recommend amlodipine during pregnancy or breastfeeding. If you are pregnant, planning pregnancy, or currently nursing, you must consult your doctor for a safer alternative. Because while controlling your blood pressure protects your heart, it should never come at the risk of your baby's health. Now, what about the right dose? Typically, doctors prescribe between 2.5 milligrams to 10 milligrams once a day, with 5 milligrams being the common starting point. The exact dose depends on how well your blood pressure responds in the first couple of weeks. This is why regular check-ins with your doctor are essential. How do you actually take it? Amlodipine should be taken once a day, ideally at the same time each day to keep the medication levels steady in your system. Most people take it in the morning. It can be taken with or without food, but always with a full glass of water. And consistency matters, because if you stop, your blood pressure will likely rise again. How long will you need it? For most people, the answer is lifelong. High blood pressure doesn't just disappear, and this medication is designed to keep the pressure under control for the long term, reducing your risk of heart attacks and strokes. So, when does it start working? You may notice some effect quickly, but it usually takes about a week of daily use to reach its peak effectiveness. Your doctor will typically wait at least 2 weeks before adjusting your dose. Interestingly, because high blood pressure often has no symptoms, many people won't feel any different even though the medicine is working quietly in the background to protect them. Now let's talk about something important: foods and drinks. Grapefruit products should be avoided because grapefruit contains a chemical that interferes with the breakdown of amlodipine, leading to higher levels in your bloodstream and a greater risk of side effects. Alcohol is generally safe in moderation, but in some people it can intensify dizziness and flushing, so pay attention to how your body responds. But what if you forget a dose? If you remember the same day, take it as soon as you can. If you only remember the next day, skip the missed dose and continue as normal. Never double up to make up for a missed pill. That can be dangerous. And on the other end of the spectrum, if you accidentally take too much, symptoms like dizziness or extreme drowsiness can signal an overdose, which requires immediate emergency care. Now, before I continue with side effects, a quick note. If you'd like more clear, science-backed explanations about how medications affect your health, make sure to subscribe. I share trustworthy advice just like this every week, and there's so much more to come. So, what about side effects? This is where patients really need to pay attention. The first thing many people notice is swelling, especially in the hands, feet, or legs. Because the drug relaxes blood vessels, it can sometimes cause fluid to build up in your tissues. Another issue some patients report is muscle cramps, unusual tiredness, or a general sense of weakness. On its own, this might be manageable, but when combined with dizziness, it can make everyday tasks harder than expected. And if you think that's inconvenient, wait until you hear about what it can do to your digestion. For some, amlodipine brings on indigestion, constipation, or even diarrhea. These digestive effects don't always get the spotlight, but they can interfere with daily comfort. And just when you think it's only the stomach that's affected, the heart itself can sometimes feel the impact. A racing or pounding heartbeat is a much more concerning effect. It may signal that the medication is interfering with your heart's electrical rhythm. And if that sounds worrying, there's an even rarer but more alarming possibility. In certain cases, chest pain can develop. Remember, amlodipine is often prescribed to prevent angina, but in rare situations, it can paradoxically trigger it. That's a serious red flag that demands immediate medical evaluation. There are also effects that go beyond the heart. Some patients experience signs of liver strain, such as yellowing of the skin or the whites of the eyes. That's your body's way of warning you it's struggling to process the drug. And it doesn't stop there. A small number of patients may develop inflammation of the pancreas, marked by severe persistent abdominal pain. This should never be ignored. Finally, though rare, allergic reactions are possible, and these can be life-threatening. Swelling of the face, lips, or throat, difficulty breathing, wheezing, or a sudden rash all demand emergency attention without delay. These side effects aren't guaranteed, but knowing them puts you in control. And in our next breakdown, we'll explore another drug millions rely on every day, uncovering the hidden ways it may be affecting the body. If you're considering medication for erectile dysfunction, you need to understand the real differences. I've broken down sildenafil, Viagra, and tadalafil, Cialis, head to head, explaining their mechanisms, unique benefits, side effects, and why one might be a significantly better choice for your lifestyle. Click here to watch everything you need to know about sildenafil versus tadalafil for erectile dysfunction. ED pills and get the facts straight.